Ear infections, also known as otitis media, occur when bacteria or viruses cause inflammation and fluid buildup in the middle ear. They are common, especially in children, but can affect people of all ages. While most ear infections clear up on their own, some require medical treatment to prevent complications. What causes ear infections? Ear infections typically occur when the eustachian tubes, the small passages that connect the middle ear to the back of the throat, become blocked. This prevents normal drainage and allows bacteria or viruses to grow in the trapped fluid, leading to infection and inflammation. Common causes include colds, flu, or respiratory infections that spread to the ear, allergies that cause swelling and fluid buildup, sinus infections that block the eustachian tubes, exposure to secondhand smoke or air pollution, changes in air pressure, e.g., during airplane travel. Symptoms of an ear infection. Symptoms can vary depending on age and severity, but often include ear pain, mild to severe, fullness or pressure in the ear, hearing loss or muffled sounds, fluid drainage from the ear, in some cases, fever, especially in children, irritability, trouble sleeping, or loss of appetite, common in infants. Types of ear infections. Acute otitis media, AOM the most common type, with sudden symptoms like pain and fever due to fluid buildup. Otitis media with effusion, otomy fluid remains in the middle ear after an infection, possibly affecting hearing. Chronic otitis media, repeated or long-lasting infections that can lead to hearing loss if untreated. Who is most at risk? Children, especially under age 2, due to shorter, narrower eustachian tubes. People with allergies or frequent colds. Individuals with weakened immune systems. Bottle-fed infants, breastfeeding may lower risk. Treatment and prevention. 1. Home remedies for mild cases. Pain relievers like acetaminophen or ibuprofen. Avoid aspirin in children. Warm compress over the ear to reduce pain. Staying hydrated to help clear infections. Nasal saline spray to relieve congestion. 2. Medical treatment. Antibiotics if the infection is bacterial and does not improve on its own. Ear drops for pain relief if recommended by a doctor. Surgical tubes in severe cases to help drain fluid and prevent chronic infections. 3. Prevention tips. Wash hands frequently to reduce infection risk. Avoid exposure to cigarette smoke. Breastfeed infants if possible for immune support. Keep up with vaccinations, including flu shots and pneumococcal vaccines. When to see a doctor. Symptoms last more than 2 to 3 days. Severe ear pain or high fever. Fluid draining from the ear. Hearing loss or recurring infections. Final thoughts. Ear infections are common, but usually treatable. Most clear up with home care, but severe or frequent infections may need antibiotics or medical intervention. Preventative measures like good hygiene, avoiding smoke exposure, and staying up to date on vaccinations can help reduce the risk. If symptoms persist or worsen, seeking medical advice is essential to avoid complications.